Front and Center. A focus on important and significant developments affecting the lives of Filipinos, not only in the Philippines, but also those living and working around the world. Join us in Front and Center. Front and Center. Here on Radyo Pilipinas World Service.
Good morning to all of our listeners here on Radyo Pilipinas World Service. Welcome to another edition of Front and Center, where we put very significant issues affecting our country, the Philippines, as our program title says, Front and Center. On behalf of our colleague Jerome Toledo, I'm your host for today, Steph Vicente, joining you all for a 30-minute worth of talk discussing important matters with our government officials, people from the private sector, or even members of the academe. As seen through our video live streaming, you may watch and listen to Front and Center through our official Facebook page. Just search Radyo Pilipinas World Service. The same goes for our YouTube channel. Meanwhile, we also have an audio live streaming thanks to the Evox PBS Receiver app. You may download the said mobile application via Google Play Store if you are using an Android phone or via App Store if you are using an iPhone. Once you have entered the Evox PBS Receiver app, just find the logo of Radyo Pilipinas World Service in order for you to be able to listen live to our programs such as Front and Center. We are also back on shortwave radio starting this week, as Front and Center is part of our English service, which airs from 10 o'clock to 11:30 in the morning, Philippine Standard Time. You may listen to us via the following shortwave frequencies: 12.020 MHz, 15.640 MHz, and 17.665 MHz. For today's edition of Front and Center, we will be joined by the Philippine Health Insurance Corporation as we will tackle the Philippine Health Insurance Corporation or PhilHealth's transparency portal, as well as the outpatient HIV/AIDS treatment or OHAT package. If you could recall, we just celebrated or observed the World AIDS Day last Monday, which is December 1, 2025. And when we come back, we will be having an interview with Miss Christine May G. Magno, who is the Acting Senior Manager of Corporate Communication Department of PhilHealth. We will be right back after a few reminders from our station.
Mabilis ang trivia, dagdag talino. Heto na ang Dagling Kaalaman.
Alam mo ba, kumakain daw ng sarili ang ating utak araw-araw? Ang prosesong ito ay tinatawag na phagocytosis, kung saan ang mga cells sa utak ay nililinis ang mga sirang bahagi o sobrang koneksyon para manatiling maayos ang takbo ng ating isip. Kapag natutulog tayo, mas aktibo pa ito na parang garbage collector ng utak na naglilinis ng mga basurang selula at lumang koneksyon. At sa proseso ng paglaki, lalo na sa adolescence, tinatanggal ng utak ang mga hindi na ginagamit na koneksyon para mas maging matalino, mas mahusay at mas handa tayo sa adult life. Kaya oo, kumakain ng sarili ang utak mo, pero ginagawa niya ito para mas maging mahusay ka.
Kaunting kaalaman na malaking dagdag talino. Abangan muli ang susunod na Dagling Kaalaman.
Paano nga ba mag-register para magkaroon ng schedule sa Bagong Pilipinas Presidential Action Center? Narito ang mga dapat gawin. Gamit ang iyong mobile device, pumunta sa eGov.ph app. Pwede itong i-download mula sa Apple App Store o sa Google Play Store. Gumawa ng account. Ilagay ang email address, valid mobile number, pagkatapos ay makakatanggap ka ng one-time code sa iyong email. Gamitin ang code sa eGov app para sa verification ng iyong account at ng mga impormasyong ibinigay. Congratulations! Meron ka ng eGov.ph app account. Pwede mo na ma-access ang iba't ibang serbisyo ng gobyerno kabilang ang mga serbisyo sa Bagong Pilipinas Presidential Action Center.
Itinuloy na po natin ang zero balance billing. Libre po. Ibig sabihin, ang serbisyo sa basic accommodation sa ating mga DOH na ospital, wala nang babayaran ang pasyente.
Ang dami pong challenge, hindi po namin alam kung saan namin kukunin, ganon, nag-iisip kung paano namin mababayaran. Siyempre po, masayang masaya, super saya po dahil na zero billing po kami. Opo, malaking ano po talaga, malaking tulong po. Mabilis lang din po.
Bayad na ang bill ninyo. Uulitin ko, wala nang kailangan bayaran ng pasyente basta sa DOH Hospital dahil bayad na po ang bill ninyo.
Naiyak ako kasi sobrang saya. Maraming salamat po, Mr. President Bongbong Marcos Jr. Hindi kami nagkamali ng taong hinalal.
And now we're back here in the program Front and Center. As mentioned earlier, we will be joined by the Acting Senior Manager of Corporate Communication Department of the Philippine Health Insurance Corporation or PhilHealth, Ms. Christine May G. Magno, to talk about the PhilHealth Transparency Portal as well as the OHAT package. Ms. Magno, welcome to the program Front and Center. This is Steph Vicente of Radyo Pilipinas World Service.
Miss Steph, good morning.
Good morning, Ms. Magno. First of all, I just mentioned that we are going to talk about the PhilHealth Transparency Portal. Our first question for you, PhilHealth is among the first GOCCs to roll out a transparency portal. Can you explain what information the public will be able to see through this new platform?
Yes, Ms. Steph, thank you so much for this interview because there's quick to get everyone. PhilHealth has a new platform which called the
Miss Magno, I think we could move a little bit as the communication is a bit choppy. Okay. The connection is abruptly cut. We'll try to call again Miss Magno as this information is very important, most especially to the PhilHealth members. Okay. Let's try again, Miss Magno. Welcome again to the program Front and Center. This is Steph Vicente again of Radyo Pilipinas World Service.
Yes, Ms. Steph, good morning again. Sorry, I lost.
Okay.
As I was saying earlier, the Transparency Portal is an initiative of the DIC. So we thank the good Secretary Henry Aguda for choosing PhilHealth as among first agencies to apply this and make it available to all our members, which means we become transparent to everyone. Ways that you need about this easily available to everyone. Easy step. We already have our website, we have our social network, and you can reach us through our hotline. The good news is with Transparency Portal, there are a lot of things available to everyone that's not available in our website, so that other information may not be easily available for everyone. So with the Transparency Portal now, even researchers will have a field of information that they
Ms. Magno, how will this Transparency Portal improve accountability and public trust in PhilHealth?
Miss Steph, the really impresses me with this study is that it also shows that we have spent it, for a certain period, example, what's now available in the portal, the payment, or and also the information on the new contribution. Therefore, signals are now assured, no, through access information. Using information that hey, okay, benefit benefit payment. These are key are act I think and they get to enjoy they have package. So speaking from all in the science it needs to be all available through the financial report if you want to go through all the financial records. Right. But now in the transparency report there are performance in there are analytics, these analytics and also to help you generate the information. And we also can help select a specific area, if you're coming from outside of NCR, and you would want to know how much it still has to stay in a particular region. There's a map that now you select any map that information that is up in the page. What we would like to join everyone to the public engagement part, no, of the there you to send in your stat inquiries and
Ms. Magno, the DICT mentioned that the transparency portals will be powered by artificial intelligence or AI. How exactly will AI be used in PhilHealth system?
The AI will generate all the information that transparency portals can access. So the report actually links to our website where there's a robust information. Then the AI will transfer this information into answers. First, will try to ask information. There are also pre-identified questions in the app. Put common questions, and they should be able to read the answers. Come the data and the information ready stored in our PhilHealth website. Get information with forecast.
And what safeguards will PhilHealth put in place to ensure accuracy and fairness in AI-generated or AI-supported data?
Oh, the one thing that we can assure the public is that while this information are made of course, this will be sure that we follow the legal guidelines and the laws and data. In other words, you cannot ask information or health profile any member who was just admitted. With the data of members, it will not reveal the file of patient. And well, if you make general, it will not reveal any information that will be detrimental to including our. So, it only give the information that is fairly available to the public, at least to make PhilHealth accountable for how it is the funds, where the funds on general information are available before.
And of course, what specific PhilHealth projects, programs, and spending details will be made available on this transparency portal?
When we start basic, one of the where are the offices located? Some are not so sexy, or some prefer to get some PhilHealth office located. There's a link there that you can find the offices and addresses, contact numbers, so the list of facilities where you can be served. And since it's linked to our PhilHealth website, that see the information from the can also be accessed in the portal. But once the information is not available in the dashboard of the, it will lead you to the link to the month that mental health.
Also, will the portal include real-time or regularly updated data, for example, claims processing timelines, fund utilization, or project status?
Definitely for claims, that will be available. As of now, what we're seeing is the first semester, and that should be sufficient. In claims payment, we also have a time for reconciliation. That's why once it's already uploaded, it means it's that's available for public consumption. There's also of course, financial records is also important. The number of members and the premium contribution, total financial records, because we're very supportive of the man of the president on transparency. Our own president, Dr. Elvis Ricardo, highlights that this is not only known to all Filipinos, but teach them how to access information. That is our way of rebuilding the trust of the Filipinos. PhilHealth as your premier health insurance program for the country.
Since PhilHealth handles highly sensitive health and personal information, of course, of the members, how will you ensure that the transparency portal does not compromise patient or member privacy?
Yes, ma'am. That's an important need to hear. What information we need to read. We are the data privacy law, therefore, we allow data privacy, and that is also the need to. So, PhilHealth will not be sharing data because it's confidential to the individual. That will not be made available.
Of course, does PhilHealth have its own target schedule for the full rollout of this portal, of this transparency portal, and are there planned phases or pilot testing periods before the public launch?
The launch has been done already last November 24, 2025. Secretary after and see launched with last week. So this is now available to everyone. Everyone now visit the philhealth.open.gov.ph to have a direct access to the portal. So if you visit the PhilHealth website, philhealth.gov.ph, this is the upper right-hand corner. One of the banners there is transparency. When you click on that, you see to the transparency. So it's already up. To everyone already. The reading.
And of course, since it was already launched last month, are there any platforms where people could give at least feedback for this PhilHealth transparency portal?
Yes, ma'am. This was launched last November 2025. Part of the features of the transparency portal is the public engagement feedback. That's where they send that part and send in their feedbacks or comments to PhilHealth or what help they need, and that also link us to our own hotline. Because in PhilHealth, we also have our call center agents. We have a corporate call action center that is fully comments and feedback that reaches our corporation. So be assured that we try to be as responsive as possible as we are. With that, if I may emphasize, we received 98.9% customer satisfaction in addressing member issues and comments. So it shows our commitment to public.
We just got our call just got interrupted again. We're going to call again Miss Magno because this very important information as we have mentioned. We're trying to reach out to her again. Okay, Miss Magno, go ahead.
Yeah. Oh, okay. As I was saying earlier, the program, the Transparency Portal, was launched last November 24, 2025, and we very well encourage everyone to access the Transparency Portal through health.gov.ph. They can browse it on the internet, health.open.gov.ph. You can send in your comments and questions through the public engagement portion, where you just click that, write your comments, your questions, and that will lead to our Corporate Action Center, accept all these comments, questions, and then get back to you as prompt with the answers. If there are any complaints, we will go through a standard escalation process, making sure that all your concerns are solved on time. We follow also the ARTA rules on managing member concerns.
And now we're moving towards our second topic, which we would also like to discuss with you, as PhilHealth recently enhanced its outpatient HIV/AIDS treatment, or OHAT package. What major improvements were introduced under this enhancement?
Well, the highlight of this enhanced package is the increase of the amount of the package made available to the public. We used the outpatient IV package for only 30,000 pesos for what we have turned some of our HIV patients into advocates. Our doctors expect everyone to act on benefit, and the better news that here in February 2025, with our package of approximately 1,000 packages of increased by 90%. One of those is package, or the outpatient HIV treatment package. So now, from the 6,000 pesos package, now with illness, with the amount of 3,500 pesos per round. So this, we hope, would assure our each patients that they have to see that to help in the treatment of HIV.
And of course, as you have mentioned, the package benefit increased from 30,000 pesos to 58,500 pesos. That's annually. Just for more clarification or emphasis, what specific services or treatments are now covered under the new amount, which is 58,500 pesos?
Yes, the 58,500 pesos covers antiretroviral therapy and all the drugs and medicines not necessary for the treatment of the treatment of patients. If this has been truly responsive to our members, when it was really factor for everyone, that this will further enhance the access to working, the benefits as we practice evolve. We are getting it ready for everyone to sure everyone. Penalties are available, responsive to the actual needs nowadays.
And of course, how does PhilHealth ensure that the antiretroviral therapy, or ART, is accessible to all individuals diagnosed with HIV regardless of their clinical status?
That will have to be attended by our accredited facility. Health and health insurance determines the amount that should cover the benefit package. We are for the part attend to the needs of our patients. So all clinical approaches are followed a clinical practice guidelines, and therefore should the patient question are consulted with the providers, at the point of service.
With the Department of Health or DOH noting that more than 5,500 there are more than 5,500 new HIV cases from July to September of this year. How is PhilHealth preparing to support the growing number of people with HIV/AIDS?
Well, now that the number is really alarming, we are confident that the benefit package is not only responsive, but to assure our public that somehow they should, especially those not yet documented, because we're only talking about the 5,000 have been tested and documented. That information about the enhancement in the benefit package would reach the Filipino so that any suspecting to have this illness must have the confidence to go and seek a consult, go and visit any of our accredited HIV treatment partners. There are 280 applicants nationwide. So we hope this benefit package will really give them the assurance that is doing its best to serve the needs of our HIV patients. Then we would be needing the help of the media and all our forums to continue to highlight the availability of this benefit so that we reach every Filipino and help educate everyone this condition that must get solved.
And of course, there is also an emphasis for the confidentiality of persons living with HIV, also known as a PLHIV. What concrete measures are in place to protect members' personal and medical information, just for assurance?
Yes, ma'am. We would like to assure everyone, all our field employees, especially the frontliners, are trained to handle all your records with confidentiality. So sometimes a member or a walk-in client comes to the office, some could easily tell them, I am a person living with HIV assistance. Then our frontliners know the protocol handling of this information to assure the public they still have the certificate. Our officers are trained to handle these cases, and in fact, even in the processing of these claims, are treated as outcomes also. With the same data privacy rules that we do, but we have our employees do a non-disclosure agreement because we know that this is one area that we need to accomplish. It's not only available for everyone, it's so want to remove the stigma to everyone. Sana tanggalin yung takot that disease is not closer together. PhilHealth is journey of only this benefit available. We would like to assure you the respect
Yes. And there are 234 accredited HIV treatment hubs nationwide. Are there plans to increase these numbers in maybe in the following months or in the following years, particularly in underserved or remote areas?
Yes, ma'am. And I'd like to emphasize further that the numbers have been increased. We have the latest already 288 accredited HIV treatment centers still has accredited. The 288 Okay, that's the latest data. And of course, we will not stop from there. We will continue to reach the partners and accredited treatment hubs in hospitals, some are rural health clinics, health centers. So as long as the services can be available and certified, they are here updated. We continue to encourage more partners to join us, be accredited, so that we can address all the needs for providers to respond to the growth number of cases.
And we are running out of material time. For members who may still hesitate to seek treatment due to, of course, stigma or fear, what reassurances can PhilHealth offer?
Yes, so one thing we would want you to do, foremost, be a PhilHealth member. Not only HIV package, but all the other benefits of PhilHealth are easily made available to all members. So please be a member. You're still not a PhilHealth member now. And that alone gives you the confidence you can access, including the HIV treatment. So make sure we have been trained to handle this with confidentiality. If the stigma that affects our Filipinos and our members and even the non-members, please and try for yourself your experience health services that we're ready to offer to everyone.
And with that, thank you so much again, Ms. Magno, for joining us here in the program Front and Center. Until next time, mabuhay po kayo.
Mabuhay. Thank you very much.
And we are just joined by the acting senior manager of the Corporate Communication Department of the Philippine Health Insurance Corporation, none other than Miss Christine May G. Magno. At this point, we would just like to give acknowledgement to the people here in our studio who made this program possible, of course. There's Sir Milo Janela, Ma'am Susan Aison, Hiro Lucero, and Justin Osias. Of course, we would also like to thank our station manager, Mr. Ray Sampang. Stay tuned here on Radyo Pilipinas World Service for more updates. And as mentioned, we're now back on shortwave radio. Until the next episode of our program, on behalf of Jerome Toledo, this has been your host for today, Steph Vicente. Good day and stay safe, everyone.
You have just heard and watched Front and Center. Front and Center. Join us again for another edition here on Radyo Pilipinas World Service. Front and Center.